Thank you for joining us in our Health Talk series. Today, we are going to be talking about a problem that affects some women during pregnancy. This problem is called preterm delivery or delivering early. So, if your baby comes too early, what help can you get? First, we need to know that normal pregnancies are supposed to be up to 9 months. But due to some circumstances that we will talk about later, some pregnancies get delivered earlier. Some can be delivered as early as the 5th month, 6th month, the 7th month, or the 8th month. But any delivery around 5th month, for example, is miscarriage because the baby is not likely to make it. So the baby may not, the fetus is not viable. But after the 5th month, from around the 6th month, 7th month, and the 8th month, the baby may have a chance. In developed countries, for example, like Sweden, which prides itself as the champion of preterm care, babies born around 6th month do make it very well. But in our own setting, like Nigeria, for example, babies usually make it from the 7th month of life if they get help with a specialized care. This specialized care is given in the hospital in a specialized unit called Special Care Baby Unit or Neonatal Intensive Care Unit. So, because deliveries like this happen spontaneously or suddenly, most babies are delivered at home or in transit to the hospital. So if you deliver your baby at home or in transit to the hospital, not up to 8th month, not up to the 9th month, your best bet is to go on to the hospital where it will be given that special care. Babies delivered around the 8th month do usually do well without that special care, except if they do have a condition we call low birth weight. So, what causes babies to be delivered early? Some conditions in the mother, in the baby, or both, do predispose a woman to have an early delivery. In the baby, the commonest cause is multiple gestation. If you are carrying multiple pregnancies like twins, triplets, quadruplets, and so on, you are highly likely to deliver them early. If you have a condition called pregnancy-induced hypertension, you are also likely to deliver early in pregnancy, or diabetes, that's high blood sugar. The conditions in the babies, for example, congenital anomalies, which are structural or chemical abnormalities in the baby, do predispose the babies to be delivered early as well. So, what help can you get? In the specialized baby care unit, the baby is admitted and is put into a chamber called an incubator. Incubator mimics the conditions of the mother's womb. So the baby is kept there to stay for a few more weeks so that it can, grow and develop some reflexes, for example, the suckling reflex, so that it can survive on its own outside. It is not uncommon also to see that during this care, babies' monitoring of temperature, oxygen, and blood sugar do happen. So it's not surprising if you see the nurses frequently taking the baby's blood sugar, the temperature, or attaching a monitor called oximeter to check the oxygen level of the baby, because preterm babies are very prone to respiratory problems, infections, and fluctuations in blood sugar. So these are some of the help that you will be getting if you take your baby around the 7th month of pregnancy to a hospital. Some women do get worried, about the long-term health consequences of delivering their babies early. Well, if the doctors feel that the baby can survive outside and they discharge you home, that means the baby can do very well at home, and there is no need to worry about anything. Even in the future, preterm babies do usually do well health-wise. Thank you very much for listening. See you next time. Bye.